Part 16, Spine Injuries. Welcome to the lesson on spine injuries. In this video, we will discuss causes and increased risk of spine injuries. Spine injuries causes. Spine injuries can occur from a fall, car accident, sporting event, or almost any other physical activity. Head injuries may accompany spine injuries. A high index of suspicion must be maintained and efforts must be made to protect against further injury to the spine and the spinal cord. Increased risks for spine injury include age of 65 years or older, bicycle or motorcycle crash, pain in middle of neck or back overlying the bony prominences, intoxication or substance use, and numbness, tingling, or weakness. Injuries to the spine can be unstable, and unstable movement can result in spinal cord injury and permanent paralysis. First aid spine injury. When performing first aid in someone with a suspected spine injury, be sure to avoid bending, flexing, or twisting their head or neck. If they begin to vomit, stabilize their head and neck by placing both hands on the side of the head and neck, and assist them to their side. Maintain stabilization until advanced help arrives and call 999/EMS as soon as possible. This concludes our lesson on spine injuries. Next we will review bone and joint injuries.